The CDC has confirmed the first case of acute bird flu with respiratory symptoms here in the U.S. This newest case was reported by a farm worker in Michigan. Despite the name bird flu, this is the third human case associated with an outbreak in dairy cows. Previous patients reported eye symptoms. The person in this case claims to have experienced coughing and congestion along with discomfort in their eyes and is now getting antiviral treatment for the symptoms. Joining us now on set is Dr. Céline Gounder. She's a CBS News medical contributor and an editor-at-large for public health at KFF. So what's the significance of this being respiratory? Do you worry about potential spread with this?
This is concerning. If you think about it, it's kind of intuitive. If something is in your eye, how easy is that to spread to somebody else? Versus if it's in your respiratory tract and you're sneezing or coughing, how easy is that to spread to someone else? So that's really why this has upped our concern a bit. Is it trending in a certain direction? We have not seen human-to-human spread yet, to be clear, but it does raise our level of concern.
Who is at the greatest risk of catching this?
So it remains farm workers. The 3 cases that we've seen associated with this outbreak in the United States have all been farm workers working with dairy cattle. But we are also thinking a little bit more broadly, are there other kinds of farm workers that might be affected here? Are there communities around these dairy farms that could also be affected? And so there does need to be surveillance in those contexts as well.
So for people who are watching how this might affect them, what's your advice?
Well, I think the main thing for the general public is do not drink raw milk. We have seen evidence of the virus, dead virus, in pasteurized milk.
What does dead virus mean?
So in other words, it's not going to make you sick. It's not going to infect you. So that's the whole reason we pasteurize, is to kill bacteria and viruses that could make you really sick, like E. coli or listeria. These are viruses that can give you really bad GI infections, so diarrhea, vomiting, fevers, can even give you meningitis in some cases. So there's a reason we pasteurize. The pasteurization process works. It kills this H5N1 flu virus. So just make sure you're continuing to drink pasteurized milk.
So the dead virus has been found in pasteurized milk.
We have seen dead virus, so fragments of dead virus, using tests for that. So what that tells us is also, if you're drinking raw milk that's not pasteurized, that there's not a process to kill the virus, then you are putting yourself at risk. So really, again, stick with the pasteurized stuff. There's been a lot of misinformation on social media, people advocating drinking raw milk. This is not safe, whether it was before the H5N1 flu outbreak or now.
What are your concerns? What are you thinking about in terms of preventing a larger outbreak?
Well, what we're really concerned about is there's not nearly enough testing. There's not enough testing of the farm workers. There's not enough testing of the dairy cattle. There's not enough testing of the milk. And so if you're not testing enough, we're really kind of flying blind. We don't know what we're dealing with. And there are a lot of questions that remain unanswered. Most importantly, how is the virus mutating? Is it adapting to humans and other mammals? And is it adapting in the direction where it could spread from human to human? And if it does, that's when you end up with an epidemic or pandemic. So we really need to be keeping a finger on the pulse, so to speak, and we're not doing that right now.
Okay. Well, hopefully we won't be talking to you about this again, but who knows? We know you'll be here if we need to. Dr. Céline Gounder, thank you.